Hi, Can't See Moms. I'm Sarah McGinnity, and we are joined today with Dr. Jessica Parrott, who is a board certified and fellowship trained maternal fetal medicine physician with HCA Midwest Health. Dr. Parrott has specialized training in obstetrics and experience caring for women who have complicated or high risk pregnancies. And today we're here to talk about gestational diabetes, which a lot of moms, watching this probably are familiar. And just to give some basics before we get started, this is a condition that causes blood glucose or blood sugars to be too high when you're pregnant. A lot of us, I feel like, know of it because of the drink we have to take when you're later halfway through your pregnancy, and we all dread that sugary drink. So that's what I think of it when I think of gestational diabetes. And so we are going to talk today about if you're diagnosed, how that looks, and how it affects you and your baby during pregnancy and after the baby is born. So I think the first question, Dr. Parrott, is, will my baby be healthy? That is probably the first thing that moms think of when they might hear about this diagnosis.
So most babies of moms who have gestational diabetes are going to be born perfectly healthy. Obviously, how well the diabetes is controlled is going to contribute to that. Our goal is to try to keep those sugars under as tight a control as possible, even tighter than what people who have diabetes outside of pregnancy keep their blood sugars at. And it's all because of the effect it can have on baby. If your blood sugars are high, it can increase the risk of having a bigger baby. And they tend to kind of gain weight in the upper body more so. So kind of think football players where they have like the wide shoulders and tiny hips.
Mm-hmm.
I always get dads laughing when I reference football players, but it's kind of true. They kind of have more of that upper body increased fat. That can increase your risk for needing a C-section, can increase the risk of baby getting stuck in the birthing canal, causing trauma to either you or baby. If your blood sugars are high, it also affects how quickly the lungs develop. And so if you end up spontaneously delivering early or needing an early delivery, then there's a higher chance that baby could have breathing problems initially. Baby could have low blood sugars after birth. Just like we make insulin to bring our blood sugars down, so does baby.
Mm-hmm.
And if you have high blood sugars, then baby's going to make a lot more insulin, but then after birth, they don't have your blood sugar anymore. And so they can end up with a really low blood sugar that might need to be treated initially. And so all babies after birth get their blood sugars monitored on a regular basis during that first 24 hours. There's also a higher risk that baby could be born with jaundice, which is the yellow skin that you see some babies born with. And then there's also a higher risk of stillbirth, and that risk is directly proportional to what those blood sugars are. So the better controlled, the lower the risk to baby.
So if you do get diagnosed, what is the plan going forward once you receive your diagnosis? How is that monitored?
So it's monitored by a couple different ways. So we instruct you how to monitor your blood sugars. So we have you check your blood sugars 4 times a day. First thing when you wake up, called a fasting, and then 1 or 2 hours after you eat each meal. And you keep a log, and that gets reviewed on a regular basis, usually weekly, with either your OB provider or a high-risk doctor, so that they can make sure that those are within range. We want those fasting levels to be 60 to 90, and then those after meals to be anywhere between 90 to 130, depending on if it's a 1 hour or 2 hour. And then we also monitor baby with ultrasound. So because of that increased risk of having a bigger baby, we do growth ultrasounds every 4 weeks. So depending on how early you get diagnosed, depends on how many times we do that. And then we also do either weekly ultrasounds or twice weekly fetal monitoring. So it's where we put baby on that monitor NST. And when we start that depends on whether or not you're diet controlled or on medication. So lots of different ways that we're keeping a really close eye on baby. And then because of that higher risk of stillbirth, we also usually recommend delivery at 39 to 40 weeks.
Okay.
If your blood sugars have been really hard to control, then sometimes we have to go earlier than that, but we try really hard not to.
Okay. And then what are the chances the baby will be born with diabetes?
It's extremely unlikely that baby would be born with diabetes. There's always a chance that your child could end up with diabetes later on in life. That's more so just because of the family history of diabetes, more so than the fact that you had diabetes yourself. If you talk to most women who get diagnosed with gestational diabetes, there's either family history of mom or grandma who also had gestational diabetes, or there's multiple family members that have type 2 diabetes. And so there is kind of a genetic or familial component to that. And so that contributes more so to your baby ending up having diabetes later on in life, more so than the fact that you yourself had gestational diabetes.
Okay. Then how about mom? What are her chances of, if she didn't have diabetes before, like now she's developed it after delivery?
Majority of the time, it does go away right after birth or shortly after birth. We always recommend that you do, unfortunately, another one of those lovely glucose drinks at your 68-week postpartum visit to make sure that you don't have underlying diabetes, because by that point, the effects of the pregnancy are gone. And then we recommend that you follow with your primary care doctor at least once every 3 years to get checked for diabetes. And that's because your lifetime risk is about 75%. So it's pretty high. About 50% of those women are going to be diagnosed within the first 10 years after their pregnancy. If you have a subsequent pregnancy, it's like a 90-95% chance that you're going to have gestational diabetes, unfortunately. So I had it with my first one, and I had it with all the others as well. Things you can do to try to reduce those chances, though: eating a healthy diet, regular exercise. So that means like a moderate intensity exercise for at least 30 minutes, a minimum of 3 times a week. And then just, making healthy choices. So it's more of it's not a diet, it's more of lifestyle changes, and that can help reduce that risk significantly. Breastfeeding also can help reduce that risk.
Okay. I was surprised. I had to follow the diet, but wasn't officially diagnosed. And I was surprised. I think I thought of diabetes more as like, I can't eat sugar. And it was a very different, like following carbs and matching it with sugar and, walking after I ate. And it was just a different diet than I think had perceived.
It's not as simple as, oh, I'll just cut out the sugary drinks that I drink and the bedtime snacks. It's paying attention because, even fruits and vegetables have carbs and natural sugars in them. So it's more the quantity of carbs that you're getting and the type of carbs than the, sugars that you're eating. You can still have sugars. We're not Nazi. We're not super strict. We let you still have cake at your baby shower. We're not gonna tell you no. An occasional sweet snack isn't going to cause any harm. It's more just the majority of the time you gotta keep an eye on what you're eating.
I ate a lot of chicken breasts and vegetables.
That's what a lot of women end up doing because it's easy.
I haven't eaten a lot of that since, though, the chicken breast at least. I was tired of it.
My go-to for snacks was nuts mixed. I had just had like a jar of mixed nuts at work because my first pregnancy I was a resident, so I was running all over the place, and it was something easy to keep in my pocket in a bag. And I don't think since my last pregnancy that I've touched nuts, because that was basically all I snacked on, and I just got tired of it. So
that is hard. Okay, so during the pregnancy, what can you do to keep your glucose levels under control? We talked about kind of eating a little bit. Can you talk about maybe some other tips for during the pregnancy?
So obviously you have to check your blood sugars. You're not going to know what they are or how you're doing or what the effects of the food you're eating are without checking your blood sugar. This is more from personal experience. I usually tell people to keep a food log the first 1 or 2 weeks. It is very much trial and error. And it's different for everybody what carbs you can and cannot eat as far as how your blood sugar is going to respond. In general, we want a balanced plate that has lots of colors. That's like the most basic way to think about it. You always have to have protein with your carbs because that's going to help keep it from spiking really quickly and then crashing down. Kind of think that like Thanksgiving coma where it's like all carbs and you want to sleep afterwards. But for me, I could eat pasta, but I couldn't eat bread. Even if it was the exact same number of carbs. So there is a lot of trial and error, and it's, pregnancy brain is real. You forget a lot of things. So trying to think back even 24 hours to what you had for dinner last night and why your blood sugar was high can be difficult at times. And so just keeping track of what you're eating for each meal that first week so that you can start to pick up patterns. Be like, oh, my blood sugar was high for dinner on Tuesday and Thursday, and both times I had broccoli. Let's try having the same thing without the broccoli and see how or replacing it with a different vegetable, green beans instead of broccoli or whatever.
Yeah.
So I think it's, you don't have to do that the entire pregnancy, but just from personal experience, I do find that helpful. I think it makes it a little bit easier to kind of figure the diet out.
Yeah.
Like you mentioned, going for walks after you eat, definitely any type of exercise doesn't have to be strenuous. We don't want it to be strenuous, especially in the third trimester, unless you've been doing that the entire pregnancy. But just going for a walk, riding on a stationary bike, doing some yoga, any type of getting up and moving around is going to help bring those blood sugars down. I know a lot of women who would check their blood sugar and would come in telling me, well, I figured out if I walk 20 minutes, if my blood sugar is this, then it'll come down to this. It's not quite that easy of an exact science, but it definitely does help.
Okay.
So.
And then as mom gets closer to delivery, will she need any special care?
So during delivery, if you've been on insulin, then usually we end up having to give you insulin through your IV during labor because we're not really letting you eat and we want to make sure that your blood sugars are staying under control. If you've been on insulin, make sure to check with your doctor before you go in for delivery to know how much of your insulin or whether or not you should take it before you go in, because we also don't want your blood sugars bottoming out when you're not eating. But otherwise, that and the snacks that they let you, rather than getting popsicles and Jello for your clear liquids, it's going to be the, no sugar or low sugar versions of those, the diet Sprite rather than the regular Sprite. Other than those little things, then there's not really much that happens differently during labor. And then, like I mentioned, for baby does get blood sugar checks afterwards.
Okay. And then you already kind of alluded to this, but breastfeeding is a go and can be helpful.
Yes, breastfeeding can be extremely helpful. For one, it can help with maintaining your blood sugars and keeping them stable. It also helps primarily with just weight loss. So you're burning more calories by making breast milk. And so it's one additional benefit of helping get that weight off afterwards, because that's an important factor in trying to reduce that risk of developing diabetes later on.
Okay, so just kind of to wrap up, if a mom is listening to this, maybe, newly pregnant or maybe even going in for that sugary drink soon, what would you tell them as advice for just educating themselves and, thinking about this as a potential complication?
The more you know, the better. I mean, I feel like that's anything in the medical field. Ask questions. Don't be, no questions, too stupid or unimportant. Even if it seems like it's not that big of a deal, still ask. Also, there's people ask a lot of times for like meal plans. It really is individualized. So if one thing doesn't work out, try something different. So it's, I think this is one of the few times where I actually feel like on social media, the groups for women with gestational diabetes or whatever, where they're sharing diet ideas and meal plans and that kind of stuff is actually extremely beneficial, because you might be struggling with something that someone else has dealt with and they can give you some suggestions on different brands of a snack, whatever the case may be. And it's one of the few times where I would say that it's actually really helpful. And there's a lot of good information out there for women who've had it before. You'd be amazed at how many of us there are out there who've had it and have gotten through it. So just make sure to ask questions, because you only have it for a very short period of time. We want you under good control really, really quickly. So it's not like we're giving you months to figure this out. We want you to figure it out in a week or two. And it can be very overwhelming. And, nobody wants anything to happen to their baby. They don't want to be considered high risk. I always joke that the minute someone walks into my office, their blood pressure spikes. Not anything against us. It's just the anxiety of being called high risk. But it really is a very common thing. And, the more you know, the better.
Yeah, I found even when I was trying to follow the diet, like, a Costco or, shopping list for gestational diabetes, and it'd have, the things that would qualify, or, keto products that have better, protein and.
Yeah. Having had it does make it a little bit easier when I'm talking to patients, because they'll be like, I'm really struggling with ideas for snacks and that kind of stuff. And so then, with 3 pregnancies with gestational diabetes, I easily can pull, off the top of my head, rattle off like 10 different options, because speaking from experience, if you try to eat the same thing over and over and over, you're never going to want to touch it again. So I don't know if I will ever eat mixed nuts again.
But it's overwhelming, but I'm sure that your personal experience just is so comforting in a stressful situation.
Yeah.
Well, thank you for all you do for Kansas City moms, and to HCA Midwest Health for organizing this talk. And we thank you so much for your time.
You're welcome.
Thank you, Dr. Parrott.